My name is Jacquie Micallef, and I am the Vice President of Community Engagement with Parkinson Canada. And the goal of the presentation that I'm bringing forward today is really to provide an overview of key data points and evidence that have been collected over the past couple of years to really paint a picture of access to care for Parkinson's in Canada. The data and information that have been gathered for this presentation and analyzed are drawn from several different sources, including the Public Health Agency of Canada through their chronic disease surveillance system, Parkinson Canada survey that was conducted by Ipsos, and a Parkinson Canada environmental scan. So I'd like to start by talking about wait times and some of the data that has been collected around wait times for diagnosis across Canada. And so what's being brought forward is really national, looking at sort of national averages and evidence that has been collected. So on average, about 1 in 5 people with Parkinson's have reported having to wait more than a year to receive a formal diagnosis of the disease. And further to this, it's important to note that many Canadians receive this diagnosis by, in some cases, general neurologists, family doctors, and are unable to access Parkinson's specialists. Without a diagnostic test for Parkinson's, something like a blood test, an accurate diagnosis of Parkinson's needs to be determined then based on a clinical assessment. The national average wait time to see a Parkinson's specialist that we have found is around 11 months. In some regions, they're experiencing greater wait times of more than 2 years. It's also important to note that this data was collected prior to COVID-19, and we do have some anecdotal information coming forward that in some cases those wait times have been extended with the impacts of COVID-19. For those seeking access to a specialist, as we've said, it's been these wait times can be quite long. And in Canada, there's only one specialist, Parkinson specialist, for every 130 people who are diagnosed each year. So that ratio does not take into account that many of these specialists are concentrated in urban areas, making it very difficult and a greater challenge for those who are seeking diagnosis in rural or remote communities. So access discrepancies across Canada in terms of access to some therapies and treatments to manage Parkinson's. So government health insurance is the primary source of funding for surgical treatments. As you see here, those would include deep brain stimulation or duodopa. And there are discrepancies in funding and availability for these types of treatments from provinces to territories that can contribute to inequitable access across the country. Additionally, we know that about 55% of people with Parkinson's use government health insurance to help pay for their Parkinson's medications. So differences in public drug coverage across the country prevent some people from accessing the medications that they need to help manage their symptoms. In a survey, healthcare professionals were asked to rank services based on their importance for Parkinson's care. These are the top 3 services that were brought forward by people by healthcare professionals caring for people with Parkinson's. And the first component is around having regular appointments with specialists. There is approximately 1 specialist for every 1,025 people living with Parkinson's in Canada, which is why less than 50% of people with Parkinson's report being able to be treated by a specialist. As we discuss the rising prevalence of Parkinson's in Canada, as we know it is on the rise, it's important to recognize that the number of Parkinson's specialists is also not growing at that comparable rate, making those wait times and access to specialists even more difficult. Okay, just just going to skip forward. The second most highly rated service is attending physical activities and exercise programs, which is the second piece that's reported by healthcare professionals. Research continues to demonstrate that the importance of exercise in management of Parkinson's and how critical that this can be. Unfortunately, the current healthcare framework is not built to support individuals in accessing these services. Some of the financial realities of healthcare costs for people with Parkinson's. So over 40% of people living with Parkinson's and their care partners have reported difficulty in paying for healthcare bills related to Parkinson's. Workplace benefits are often a source of funding for allied healthcare professional services like physiotherapy. Unfortunately, also over 40% of people with Parkinson's aged 18 to 64 report being unable to work and therefore not able to utilize or access those types of workplace benefits. In fact, 1 in 3 people with Parkinson's express difficulty in accessing insurance coverage. And without coverage, individuals, especially those on a fixed income, may be limited in their ability to use healthcare services that they can be paid for out of pocket. In a survey around out-of-pocket expenses for people with Parkinson's, close to 75% of people with Parkinson's say that they do pay out-of-pocket for physical activities and exercise programs that they use as a therapeutic option for managing their Parkinson's. And nearly 50% of people with Parkinson's pay out-of-pocket for their physiotherapy. As fundamental services for helping people with Parkinson's live well, these financial barriers can be very detrimental to the well-being and treatment for people with Parkinson's. Last, healthcare professionals indicated assistance in navigating the healthcare system as being critically important for people with Parkinson's to live well and manage their disease. Pardon me. So moving on to systems of care, some conditions such as stroke, for example, have established systems of care that aim to coordinate and improve care across the entire continuum. Presently, a coordinated system of care does not exist for people with Parkinson's, requiring individuals to navigate the healthcare system independently and self-advocate for access to critical services. So we bring this forward as an example of the way that the system can be coordinated to help people with those navigation challenges with Parkinson's. Parkinson's is a highly complex condition that impacts movement, cognitive, autonomic functions, so it's affecting motor symptoms as well as non-motor symptoms, and that broad range of symptoms creates a lot of needs in terms of management and different strategies that need to be utilized to help manage and help a person live well. And so that comprehensive and coordinated and integrated system is one that we definitely are, is why we're all coming together and what we hope to learn more from each other and be able to establish for people with Parkinson's in Canada.